To help us delve into this conversation, let's speak to Solome Meyer of the Cancer Alliance. Solome, you marched on Tuesday and that was the response you got on the day. Has anything else been said after that?
Good morning to you and all the listeners and viewers. No, at this stage, I think there's a bit of a silence from the Gauteng Health Department, having to go back to the drawing board, as they call it. But I think it is quite important that we actually do note that COVID and the fire, in fact, has got nothing to do with a waiting list of over 2 years for 2,000 patients. It has absolutely got nothing to do with that. So Gauteng Health Department mustn't come with that. What we also say is that the MEC mustn't now hail Chris Hani, the opening of the oncology unit at Chris Hani, as this is going to solve all the problems. No, it's not. Because quite honestly, what has happened is that Gauteng Health Department procured equipment, radiation equipment for Chris Hani as well as George Makuri hospitals. Those machines cannot be installed for the reason that there's no bunkers in those hospitals. That means money has been wasted. And that is the reason why we're asking for a technical task team with experts.
So this situation really has been bad for a long time. Describe to us just how dire the situation is for these cancer patients.
So when you have a cancer diagnosis, that in itself is a major obstacle in your life, because you've got to deal with the question of whether you're going to actually get your treatment and whether the treatment will be effective. Please, I think we also need to understand that the majority of our patients in the public sector do come from poorer areas where the access to screening facilities are actually very poor. So by the time they are actually diagnosed with their cancers, they most probably are diagnosed with a late-stage disease that is very challenging to actually treat and manage. Now, if you get your chemotherapy, but you are then put on a waiting list for the radiation therapy, you are sent home. And this is in effect what has happened. The patients have been sent home and they do not know whether they are going to get treatment. Then what happens is, if you start presenting with other symptoms, headaches, whatever the symptoms may be, you don't have access. You just literally are given a Panado and sent home. And we have patients that have presented with what is then called metastatic disease. That is disease progression, which then means effectively that it's very challenging to manage those patients. You can perhaps give them palliative care and hope that there would be pain medication available in their local communities. That is the reality of a cancer patient not receiving treatment.
I read somewhere where one of the cancer patients was describing just how scary it is being on those waiting lists and not knowing what's going to happen next. And they described how they're being given Panados at the hospital and being told to go home. It seems that even if Charlotte Maxeke's oncology unit is operating at full steam and Chris Hani is as well, we still need an overhaul of this entire treatment process.
100% correct. We have published, as the Cancer Alliance, a report, what we call the cost of cancer. And in that report, we actually highlight and predict the increase in cancer incidence over the next 10 years. It is going to grow exponentially. This country cannot afford cancer denialism, as we had AIDS denialism 10, 20 years ago. So what we are saying also to government in general is we need a rethink, a redesign and a re-engineering of the cancer care services. And this cannot be done in isolation. It needs to be what we call the partnership, the 4P partnership, which is patient, public, private, philanthropy partnerships. It cannot only be where government is involved. You need absolutely, we need to co-create the new space for cancer, and that we actually have to do sooner rather than later. So we are asking government also, walk the talk.
You've given your demands to government. What's the response been to the other role players from the other role players that you've just mentioned?
So we have also submitted as we have committed that we will send our demands to the South African Human Rights Commission. We have done as much. We've also sent the same to the National Treasury, because there are aspects within the tender that has to be investigated. And we've also sent it to the National Department of Health, the acting director, DG of the Department of Health. So we are, it's just 2 days later, so we are still awaiting the response. And we will also inform the Minister of Health, the Deputy Minister of Health, and the Portfolio Committee on Health. We are taking this serious because, quite honestly, we have been asking for action for years.
Well, thank you so much for joining us, and please continue to fight the good fight. Solome Meyer of the Cancer Alliance joining